So it will be 10 past. Anissa, are you ready as well?
Yes, I am.
So the chat will be also available, so our members can ask some questions in the chat if they will pop up during the discussion.
Anya, can I start now?
Yes, sorry, I was fixing some last technical things, but we are ready to go now. So please take it over, Anissa, and for the technical team, you can also start the live stream. Thank you very much.
Thank you. All right,
please
start the sessions. I will take over the discussions here. Well, honorable to all the panelists, good morning, good day, good afternoon, good evening to all my dearest delegates. My name is Wsaba Anissa. Kindly call me Anissa. I'm the chair of Standing Committee on One Health in International Veterinary Students Associations, or also known as IVSA. It is my pleasure to have the opportunity to moderate the panel discussions under the topic Role of Veterinarians in the Pandemic, Preparedness and Response, and the role of veterinary education in regards to pandemic. Well, ladies and gentlemen, as it is written on the open letter to G2 leaders from the Action for Animal Health Coalitions, the only way to protect us from future pandemic is through a holistic approach called One Health, which function on the health of people, animals, and the environment. But the transformative potential of One Health can only be realized if we invest in weak animal health system across the world. To be concluded, our health systems won't prevent pandemic unless we invest in animal health. Therefore, this panel discussion will be our opportunity to learn more about role of veterinarians in the pandemic. Okay, so I think we really need to know about our panelists. So for the next agenda, I will give the opportunity to all panelists to introduce themselves and share a brief illustrations of how their organizations took action and what role it played in facing the pandemic. And as we will have very interesting topic, I will give all of you, each of you, a 5-minute overview to introduce yourself. As the first opportunity, I would like to invite Dr. Patricia Turner as the World Veterinary Association President. The time is yours, Doctor.
Great. Well, thank you so much for this kind invitation. And I'd like to say hello to all the participants today. It's really a delight to be here. As was mentioned, my name is Pat Turner, and I'm currently the president until the end of March of the World Veterinary Association. And for those people who may not be aware, the WVA is an association of associations. So it represents veterinary associations around the world, a little over 600,000 veterinarians under that umbrella association. So the WVA, this has always felt that One Health is a really critical issue. And we have a One Health strategic focus group actually that emphasizes this particular issue. So many things that we do as veterinarians, will touch directly on human health or indirectly through public health, through human-animal bond, through food safety and security, and also with the environment, as we have really been seeing over the last few years. Throughout the pandemic, we have been trying to support veterinarians in member associations and worked together with early in the pandemic with the OIE to try to ensure that governments were recognizing veterinarians as frontline workers, and were not frontline health workers, and were not inhibiting or restricting their travel or their ability to get to work. Last year as well, in the summer, we worked together again with the OIE to issue a statement to strongly support governments to ensure that veterinarians had access to COVID-19 vaccinations because of the nature of their work, being at this critical interface and the risk that they were facing in their jobs. And I think that speaks to the theme of your conference of veterinarians as everyday heroes, going out there day after day throughout this pandemic and helping to support animals, but also people in their communities through vaccinating individuals, but also through the work that they were doing with animals. I think that's probably sufficient just for an introduction. I'm happy to turn it back to you, Anissa. Thank you.
Thank you very much, Dr. Patricia, for the introductions. So for the second one, I will invite Dr. Siraya Jenekamrai as the World Small Animal Veterinary Association's president. The floor is yours, Doctor.
Hi, I'm just going to quickly see if I could share. Does that show up somewhat? Sorry, does the screen show up?
Yes, we can see it.
Okay. I was tasked with a 5-minute overview of the WSAVA. Some parts of that is not specifically only to One Health, but I wanted you to see it in the context of how it could be related to what we're talking about right now. And then we can go a little more in depth while we do the question Q&A. All right, so though instead of starting with who we are and what we do, let's start with why. So we exist because we believe in a culture of advocacy for the welfare and well-being of animals. And this, in short, impacts well-being of humans. Well-being is now the buzzword, even before and especially during the pandemic. So who's that community of believers? 115 member associations spread across the world, and it's still growing. So and the reason actually that we should come together is because we really need to believe that we're more than just a service provider in the sickness industry. We are, in fact, a keystone in the wellness industry. And that's what this pandemic is calling us to take a place in. We definitely need a community of support to realize that collective potential. This is directly speaking about One Health. So, like IVSA, we have international committees, 18 to be exact, creating outputs that support that role. But how do we know what our global community of vets really need? This is where an engaged community is really important. That's why we're able to understand what's happening and in our profession globally and what the needs and capacity are. In fact, one of the key surveys that was conducted was a global together with CM Research right before and during the pandemic that brought out a lot of key issues that made us understand more what all our global heroes are going through. So output is therefore designed to be relevant to our members so that we can all come up with a global level that we call One Care. But it's not just about guidelines. These are guidelines that are produced and are original content from WSAVA international committees that strive to support that vision to happen. But it's not just about practice guidelines. Each and every committee also campaigns on issues of global relevance to vets, and in particular, those relating to welfare. So for each issue, we also prepare a position statement which outlines our views on the topic. This is creating one voice. And last, final point is creating the one community. So in the past, this is what it often looked like. But now, one of the best things that happened out of this pandemic is O2O, the ability to transition between offline to online platforms. This created a global level playing field whereby we could connect in ways never before, so widespread so easy, so fast. You're experiencing that too, right? So, however, how we do things could have changed from the disruptive nature of this pandemic, but our why still remains the same. And the community yearns not only for high tech. That's why your exco is now in Mexico. We also yearn for high touch, and our gatherings that are soon going to be resumed will be gearing up towards this event in Peru. Last, many things have collective consciousness and the collaborative leadership that we're enjoying. WSAVA values the work that we do together with IVSA. So ask your president when and where you could be involved, because in the end, how we position ourselves, how we're going to get through any kind of crisis, how we're going to find our place in this world and make a true difference is to create one community, one care, and one voice. So that's my very quick overview of the WSAVA. And let me quickly unshare and stop right there. So you could carry on with the other parts and we can start the discussions on the key points a bit later.
Thank you very much, Dr. Siraya. I will give a short highlight with the collaborative leadership and collective consciousness. It's very new perspective. And then I will continue to Dr. Wolfgang. Please correct me with my pronunciation, Doctor. So the time is yours.
No, pronunciation is absolutely fine, Anissa. Thank you very much. My name is Wolfgang Dohne. I'm the Senior Vice President of FECAVA, the Federation of European Companion Animal Veterinary Associations. And I'm talking to you today from the middle of Sweden, a lovely town called Sundsvall, which is on the Gulf of Bosnia, which you might like to investigate later on the map. Well, we are talking here about companion animal veterinarians, and you might think, okay, what is our role in a pandemic? And at first sight, you might think, yeah, well, this is dogs and cats has not much to do with transmissible diseases in a larger scale. And you might actually be so wrong. I think we as veterinary surgeons, although we might end up treating just a selected number of species, due to the education that we, and actually you as veterinary students get, we are uniquely skilled to address pandemic situations, and our task, even as companion animal veterinarians, is to keep an eye out for the general public. Our organization, the Federation of European Companion Animal Veterinarians in Europe, was one of the first organizations to bring out COVID guidelines, which were not only for use in companion animal practices, but also for a lot of other organizations that did not know at the time how to continue handling the general public. And our suggestions, our guidelines were very often copied from other professions because we had the overview how to address something like that, not only to protect the general public, but also to protect our own employees. So this is a typical example of where we were also involved. The next thing was, once the pandemic started, you might recall that the first reports came from dogs and cats also be susceptible to the coronavirus infection. We, together with our friends from WSAVA, were out first with information to try to stay calm and to stick to the facts, to avoid that there was suddenly the blame put on companion animals, especially with a condition like SARS, for example, where it was very likely that information could have gone over the top, for example, to blame cats for the onset of this condition. The next thing was what we as a companion animal veterinarians could help with was to utilize the laboratories we are using, veterinary laboratories, to give a helping hand to the human sector. There was a severe shortage of possibilities to do PCR tests. A lot of veterinary laboratories that were normally handling only veterinary tests were very, very quickly able to provide PCR tests and were giving a helping hand to the human sector. And last but not least, in a lot of countries, finally, our human colleague woke up to the idea of One Health involving veterinary surgeons to provide vaccinations in veterinary practices. And a lot of our colleagues have, by doing this, saved a lot of human lives and have given a practical hand in dealing with this pandemic. So you can see there are just so many different aspects where we, although we are not dealing sort of with public health issues as the first side, as companion veterinarians, animal veterinarians have played a large role, and we continue playing a large role in fighting a pandemic and in public health. Thank you.
Thank you very much, Dr. Wolfgang. I will continue the introductions to Dr. Despina Latridou from Federation of Veterinarians of Europe, or FVE, Senior Policy Officer. The time is yours, Doctor.
Thank you, Anissa, and thank you once again to all of you for this kind invitation to be with all of you today here. As said, my name is Despina Latridou, and I'm a Senior Policy Officer at the FEE office in Brussels. FEE stands for the Federation of Veterinarians of Europe and represents the veterinary profession throughout the whole Europe. We are an umbrella organization of 45 national veterinary associations and veterinary chambers in 39 European countries. The veterinary profession, as we all know, is a very diverse profession, providing many different career pathways. And that is also, as a FEE, we have 4 sections, each one of which represents a vital part within our profession. So we have one session, the biggest one, that represents the veterinary practitioners, one that represents the veterinary hygienists, one representing the veterinary state officers, and one representing the veterinarians working in education, research, and industry. So as a FEE, we try to represent the whole veterinary profession and strive to speak through one voice. The mission of FEE is to enhance animal health, animal welfare, and public health, and protect the environment. Though FEE fully embraces the One Health concept, and our motto is always that veterinarians care for animals and people. The 5 key priorities of the new FEE strategy are to ensure sustainability by promoting One Health concept and intersectoral collaboration, to be inclusive and encompass the whole veterinary community across its diverse roles, to ensure that the veterinary profession is recognized and influential on the society by both making all aspects of veterinary medicine more visible and by keeping the veterinary well-being high on the agenda. And also we're looking to ensure that the veterinary profession is an attractive and rewarding professional pathway. Finally, we follow up developments and we look into embrace new technologies and prepare veterinarians for this new area. In this respect, FEE had a pivotal role through this pandemic, and our first priority, of course, was to ensuring that veterinary services remain essential services and that veterinarians will continue to deliver their work and see their clients and see animals. Further to this, we looked into supporting the veterinarians into delivering these services, both in practice, but also in food business, because veterinarians have an essential role in ensuring food safety within the consumers. So to give some examples, we have created practical guidelines for veterinarians in a clinical practice. We did that together with FECAVA, and these guidelines were translated in more than 20 languages and spread throughout the world. We have developed also practical guidelines together with the Food and Agriculture Organization for the veterinarians working in the food business in order to ensure that they continue to work safely in slaughterhouses and food businesses. We also have been monitoring all scientific evidence about the impact of pandemic in humans and in animals. Wolfgang already mentioned about companion animals. And we communicated all this information to our members together with all information on how is the situation in the different countries. We did it via regular updates, and this was very much appreciated by our profession. We also provided advice to veterinarians on how to cope with this particular situation and also how to keep their mental health, which was important in order to continue. And of course, an important part was to look into using telemedicine in a responsible way. Further than this, FVE has been the liaison between the profession and the policy makers, and in this role, we ensured on one hand that the profession contributes to policy making. One important role that we had is that we advocated for veterinarians being a healthcare profession and requesting an equal consideration with the other healthcare professionals. And on the other hand, of course, we looked into supporting our profession in order to efficiently comply with all ethical and legal requirements and deliver quality services to the society. As said, we liaise with a wide network of stakeholders that involves stakeholders in Europe, veterinary stakeholders, but also across the whole world, and includes also stakeholders from other professions like doctors, dentists, and pharmacists. So that is, in a nutshell, a first introduction of our actions, and I would like to wish you a very fruitful discussion and also a very successful overall meeting. Thank you again for the invitation.
Thank you, Dr. Desfina. So, like the importance of veterinary science, the field of veterinary education plays a major role in dealing with pandemic and even preventing future pandemic. Therefore, I will introduce Dr. Stefan Martinat, from the President of European Association of Establishment for Veterinary Education, or also known as EAEVE. The time is yours, Doctor.
Thank you, Anissa. Hello, everybody. And as we are working on different time zones, sometimes it's good morning and sometimes it's good afternoon, even good evening. I'm speaking here from France, Lyon. As said, I am the president of the European Association of Vet Establishment, which is an association with around 100 members establishments, located mainly in European countries. We have now establishment in 34 European countries. For us, European is considered as a wide aspect. It includes, for example, Turkey. It still includes UK, but also Ukraine now. And we also have member establishment which are not European establishment. We have accredited establishment in Japan, and we are highly proud to host some relations with establishments in Indonesia, in Brazil, and in Thailand, where they are seeking for our system of evaluation. If mission is to evaluate, promote, and further develop the quality and standard of veterinary medical establishment and their teaching, within but not limited to the member state of the European Union, as you can understand looking at our members. Our objective are in two levels. The primary objective is to monitor the harmonization of the minimum standards set down in the study program for veterinary surgeon in Europe, following the European directive through the evaluation system called EASYVET, European System on Veterinary Establishment Training Evaluation. And the other objectives are to reinforce cooperation between member establishments, to act as a forum for discussion in order to improve and harmonize veterinary education, and also to support and to help establishment to improve their own education and to increase their own teaching force and teaching projects. I should say that EVE is also part of a global network we have in Europe called ECCVT, together with FVE, but also EBVS, the European Specialist Association, UEVP, the European Association of Practitioners, and also IVSA, who joined us in this group. Back to what was asked about our activity during the pandemic. The main goal of EVE was to maintain contact between establishments during this crisis. As we all know, this was quite complicated for education establishment, but we work to share information and to share good practice between our members to allow everyone to maintain education online mainly, but to maintain also material to be able to have a high level of education, for example, at the clinical level. So we share those good practice, but we shared also data about the effect of new teaching methods on students, staff, and faculty members. As we all know, this was very important to follow up and to correct the impact on the welfare of everyone during this period. So the evaluation system conducted by EVE was not stopped, but we adapt our rules to support the establishment, which means that we decide not to stop the evaluation. We are evaluating the establishment on a 7-year circle, but we set up transitional rules to be able to, for the establishment to postpone the visitations for evaluation during the pandemic. One of the important points EVE was decided was to maintain the visitation not full online, but to maintain the visit on site by some experts, which was very important for our members, as we all know that it is important not only to read documents, but also to be able to discuss and to share information during visitation. And this is what the experts did with staff, with faculty members, but also with students on site. So now we are also working on the future, and so we are dealing with some topics, and one of the topics is One Health. This will be one of the key topics during our next educational day, which will take part in June, just after our General Assembly. This is a place where establishment will share what they already done, what they have already done in this topic, and where also we will be pleased to hear about students' perspective, because it is always very important for us to think about further development of education, but to rely on how this is taken and what are the expectations from the students. And this is why we are very pleased to share a very close contact with IVSA because this is a key point for further development on education. I will stop there, and I will be pleased to answer questions in the future. Thank you.
Thank you, Dr. Stefan. So for the next turn, I will give to our lovely Anya Kioskiewicz as the International Veterinary Students Association President. The time is yours, Anya.
Thank you very much, Anissa. So most of you have probably met me already. My name is Anna, and I'm president of the International Veterinary Student Association. What is IVSA? The largest veterinary student association in the world. We are uniting over 38,000 members from 6 different regions of IVSA, 6 different continents, and over 70 countries at the moment. The diversity is what makes IVSA so unique. Thanks to our virtual and live events and other initiatives, we can network, we can exchange our views, we can learn from each other and broaden our horizons as veterinary students to gain new perspective on the veterinary medicine. Projects run by our standing committees. We have currently 5 standing committees and 1 network. They help us to raise awareness on the topics such as veterinary education, animal welfare, One Health, soft skills and career attributes, and of course, mental health among future veterinarians. So there are a variety of reasons to be involved in IVSA. Our cultural backgrounds, everyone has also very different ideas for their potential future career paths. And this is also what makes IVSA so unique. Each of us is passionate about very different aspects about veterinary medicine, be it public health, clinical skills, infectious diseases prevention, veterinary education, or students' mental health. And we work very closely also with other student organizations, especially organizations for human doctors, pharmaceutical students, dentistry students, and agricultural students. So we strive to raise awareness about the importance of One Health and multidisciplinary collaboration at the very early stages of education already. And this passionate future professionals, this is what can really drive a change. The experience, conversation, ideas are brought back to members' own countries, and it helps to improve the veterinary education and medicine in the future worldwide. Regarding COVID-19 response and the role of IVSA in it, we have currently 6 regional teams that are gathering together members from 6 regions of IVSA. So this is the Americas, then we have Europe, Middle East and North Africa, Sub-Saharan Africa, and Asia Pacific. And those regional teams gather together very motivated members that come up with various ways to support veterinary students in their own country, in their own region, and then also on a global scale by awareness campaigns, by projects, including, for example, our symposium like today, cultural exchanges, and in addition, of course, IVSA standing committees that I have already mentioned. They organize fun and also educational activities for our members. Some of the examples of the activities include Wellness Toolkit for students' mental health, IVSA Cookbook, which is a really nice exchange of culture and nice food worldwide. Then we had the essay competition of our One Health and Veterinary Education standing committees, and also annual welfare campaigns, and AMR Youth Summit that Anissa was part of this project this year with also other student associations. So these activities help students to be motivated during the difficult times of lockdowns during the global pandemic. They encourage them to use this difficult time, not for just staying at home, but for being proactive, for self-development. And it's giving them the space to discuss veterinary and also personal issues and problems that we face every day. IVSA members are also involved in policy making. We, for example, created a policy statement together with our human doctor friends on animal welfare, environmental health, and One Health approach to prevention and to response of outbreaks of zoonotic diseases. And the statement is called Young Professionals Demand an Immediate Change in the Approach to Infectious Diseases Surveillance and Response. And I think the title pretty much talks for itself. We are also part of IFMSA and IPSF delegation to the WHO Executive Board meeting that took place in January 2022. And we delivered a statement on behalf of students stating our opinion on infectious diseases prevention and control. And I think it was a very important step for me to deliver that statement at the WHO Executive Board meeting as a veterinarian and not a human medicine student, calling for importance of involving veterinary services and One Health approach by the WHO member states. Last but not least, I would also like to talk about students' mental health. We had recently, or at the beginning of the end of the past term, conducted a survey by IVSA Standing Committee on Veterinary Education about how the pandemic affected our future possible career paths that we would like to take as veterinarians. And it showed the lack of practical classes had a negative impact on the confidence of students as future clinicians. And some of them said that they would prefer to move forward with more theoretical career paths in more theoretical fields of research and also policy making, which was quite interesting finding for us. The mental health of our members was undoubtedly being affected by the rapid changing restrictions, especially rapid changing restrictions and rapid changing study methods by veterinary establishments. And also, of course, by the global pandemic. On top of it, IVSA is striving to support them by raising awareness about this very important mental health issues among ourselves, among students, but also bring it up to our partners, bring it up to our universities. So this is the role we played in the pandemic in the past 1.5 years, and we'll definitely not stop there. Thank you very much. I will also be happy to answer more questions regarding this topic.
Thank you very much, Anya. So after the introductions, we can move on to like more interesting sessions. We will have a follow-up discussion on the topic of pandemic and preparedness and response. So as like what Anya said before, that we have asked our member to submit questions beforehand, and we are happy to receive the questions from a very diverse members of IVSA. So maybe like for the first questions from IVSA Morocco, the question is addressed to Dr. Siraya from Wsaba, and I will read the questions first. So the question is, what strategies can be implemented by international stakeholders to improve the feasibility and understanding of the many aspects of veterinary practice by the general public? How to popularize the image of the veterinarian, all while avoiding common stereotypes? Can you understand the question, Doctor? Am I clear enough?
I think so. I think so. I'm thinking of how the question came to ask about how we tackle with the image or the professional image. Is that basically what? And it's a global issue. It's not just in one country. It's not even just in a developing, or it's in all countries all over the world. And that's essentially a lot of feedback that we're getting back from our members as well. I think that as a response to that from an organization is part of how we come together as a community and what you build as your image and your self-image. This is your tribe. What are we doing? Who we are, much more than what we do. And I think that because we go around, we are concentrating so much on what we do and proving to ourselves that we are also part of an industry that we don't belong to. And I'm going back to talk about the sickness industry. I still do believe that in this pandemic situation, where we are already seeing why we are more situated in the wellness industry, the impact that trying to build our image to fulfill certain expectations in society creates that stress level that a lot of your student survey, not just your student survey, but also our professional wellness survey came back with. The impact is decreasing the professional wellness scale. We're having less and less satisfaction and people wanting to leave and move. So because we're suffering from this kind of expectation on our image, or trying to build up our image in the industry that we don't belong to, creates much more of that burden on us. I do think that when we come together as an organization, I'm not just talking about WSAVA, I'm also talking about when we're sitting here, we're looking at many different organizations, and actually we all are working together in collaboration. Many things that we're talking about, we already have been having dialogue and working hand in hand with. So how do we come together to truly build a global one image that can really carry us through? I'm sorry, it sounds a little bit philosophical, but I still do think that a lot of things that we try to do is we try to change our skill set, but what we should change is our mindset. And it's more our mindset of who we think we are, how we our position in the world, and what we expect of ourselves. So I'm not sure if I'm answering directly that question or not, but I would invite us all to collectively go back and look at how we view our profession and what we're trying to develop. Because if we continuously trek down the same path, we will always come to the same conclusion. But if we work together collectively in how we create a different kind of image and truly work hand in hand for the wellness or well-being, wellness of humans and animals together, we're not just treating a sick animal, we're actually treating wellness of the human by doing that. And that's one of the roles. I'm speaking from a companion animal perspective, as Wolfgang has. And I have no, how can I say, I have no excuse or saying that, oh, I'm just a small animal vet. In the role of the pandemic, 48% global rise, 48% is the global rise of caseloads across the world during the pandemic. And that's because humans are turning to the bond that we really so desire with an animal to see us through this pandemic. So our role has become even more important. We can't shy away from that now because we feel that, oh, we have to build something up.
Dr. Sirai, all right. Since we need a lot of questions to cover, so maybe like you can conclude your answer, or have you finished?
This is going to be hard. I go all around the place. Can you repeat the question one more time?
All right. So what strategies can be implemented by international stakeholders to improve the visibility and understanding of the many aspects of veterinary practice by the general public? How to popularize the image of the veterinarian, all while avoiding common stereotypes?
Back to the same thing that I'm saying, that the collective, collaborative leadership in building this up together and not as isolated independent organizations. We probably could tackle this together. What kind of image that we could help to fulfill or build together. And therefore also in terms of an internal look is to invite people or our members, with our role to be able to get people to change mindset as well.
All right, thank you, Dr. Siraya. I think I will ask like the same questions to Dr. Wolfgang. Do you want to give your perspective, Doctor? Sorry, Doctor, I think you need to unmute yourself first.
I certainly need to unmute, yeah. I think it's very important to see to show what you can do. Just don't stick just sort of in your normal routine. Adapt to the situation you find yourself in. And as veterinarians, we have the skill level. We have to be trained to do that. So that means diversify, have a look. Where else can we help? Where can we show what we can do? Where can we get more involved, especially in a One Health setting? I mentioned, for example, the use of veterinary laboratories in the diagnosis of COVID cases. That's a typical example, or where we, for example, as veterinarians can adapt and start vaccinating. And as Soraya already pointed out, we have been under a lot of strain because of the increased ownerships of dogs and cats during the pandemic. So adapt to it, realize sort of how important, what an important role we are playing as veterinarians. So, and this will also not stop with the current pandemic. There will be situations in the future, pandemic or other happenings in the global context, where we as veterinarians will be forced not only to stick to that what we sort of have seen in the past, but where completely new challenges are coming towards us. But we are very well prepared.
Thank you very much. Thank you very much, Doctor. Okay, I will continue to next questions. So we have question from IVSA Netherlands, and the question is addressed to Dr. Patricia. So how can veterinarians ensure they are included in public health conversations when they are currently aren't? Where, in your opinion, is the veterinary input missing? To Dr. Patricia.
Great, thank you, and a great question, and I think this builds on actually the previous question as well, and some of the comments that have been made. I think it really is spot on that we need to be partners and be seen as partners in all of these discussions. We want to look for commonality, which, again, when we're talking about health and well-being, whether it's environment, humans, or animals, we're all working towards that, and then look for consensus building. So some of these activities that have been discussed already, and Anna's discussion to the WHO and presenting that statement, I think we are starting to see that these forms of interaction and engagement with organizations that typically we've thought of maybe as outside of the sphere for veterinarians, that the pandemic has actually really enhanced some of these opportunities for us. We want to ensure that we're relevant, focus on the things that we really know about, and then, as I said, look for building consensus with these partners. It's about being there, and it's a lot of work, to try to do these things. But some of the techniques that are being used of being able to give a statement, press releases just in advance of significant conferences, even informal public sessions that have been held, for example, prior to the G20 to discuss One Health issues, all really important in terms of engaging people and reminding them that veterinarians are very important in these overall discussions on global health. I hope that addressed the question, but if there are other points I didn't address, please let me know.
Thank you very much, Dr. Patricia. Also, I will give the same questions to Dr. Despina. Please let me know if you need me to re-ask the questions, Doctor.
Yes, I think that I can go on, and I fully agree with what has been said so far. I think that as veterinarians, we have somehow an issue with marketing ourselves, and we have to start looking into that more seriously. We learn a lot during our studies. We are a profession that we have been since ever educated on One Health. We have been educated to protect animal and human health. We have been educated to contribute to food safety and thus to public health. We have been educated to support comparative medicine. We have been educated to understand epidemiology and the spread of disease within individuals of the same species, across different species, and between humans and animals. So we have to start speaking up a little bit more and with confidence speak about our profession, about our knowledge, about our expertise on zoonotic diseases, on antimicrobial resistance, also on environmental issues, because all those skills we have received from our education, and thus we have a good ability as veterinarians to understand the One Health concept. And this is something that we have seen that very much in all the discussions. Veterinarians understand this element of One Health much better than other professions. So this is why we are able to be somehow leading advocates of this concept and put it on this right dimension. What we miss perhaps it's a little bit more channels of communication with the other professions, and this is what we do at the moment. As a FVE, we have established a very good relationship, especially with the European doctors organizations, but also with the European dentists and European pharmacists, and we work together with them in really put the One Health concept discussion on the right dimension so that we all understand the same thing when we use this word. So this is from some perspectives from my point of view.
Thank you, Dr. Despina. So we can move on to another question. It is also come from IVSA, the Netherlands, to Anya as the president of IVSA. So the question is, how can students contribute to the reach of global programs on global topics such as COVID-19?
Thank you very much for the question, Anissa, and IVSA of the Netherlands. So I believe IVSA plays a very important role, firstly as a wonderful platform for future veterinarians to come together, create very diverse and very inclusive environment, exchange ideas, exchange experiences, and also start important discussions. But more importantly, not only discuss, but also be proactive, decide how we can already contribute and be part of the solution to different global health, public health, veterinary, animal health related problems. And we can, of course, learn from each other, collectively improve our education, veterinary education, our awareness, and our approach to the veterinary medicine. Secondly, I think I would like all of our members to remember that we are the leaders of tomorrow, and we can bring fresh perspective to the current problems, and we are very objective. We are not yet influenced by, for example, opinions of our Ministry of Health of our country or the company we work for. Therefore, our opinions can be very objective, and they are also supported by values like diversity, inclusivity, One Health approach, and we can share our ideas with policymakers, with our universities, with our friends, fellow veterinary students, and with our partners. For example, here with other international organizations that can have an impact together with us. And I think coming together makes us have a very impactful voice. Therefore, this is my call to my fellow IVSA members to please keep in mind that we are very important stakeholders. and even like the smallest project, the smallest opinion, the smallest idea of your matters. So come to us, come to our IVSA global team, our standing committees. We share your ideas, and we can see how we can make it happen. And also, I would like to highlight here how impressed I am after my half a term of being IVSA president, how veterinary students, they have ability to adapt and overcome, especially during times like the global pandemic, and change all the challenges from turning them into opportunities. So thank you very much for doing that to all my IVSA members. Thank you for the question.
Thank you as well, Anya. So I think we can, wrap up with the topic of pandemic preparedness and response. So the next one, we will continue to listening to our lovely Victoria, the chair of Standing Committee on Veterinary Education. So yesterday we had a workshop of SCOVI, the students' perspective on the role of veterinarian during the pandemic and how the university can better prepare us for it. Victoria, as like I mentioned before, can share with us the most important conclusions of our members for the workshop. I think I will give the time to you, Victoria.
Thank you, Anissa. Yes, we had a great session yesterday where we aimed to open the discussion between representatives of the academic community, clinical practitioners, and us students on this topic that we're also discussing today, the role of veterinarians and veterinary universities in a pandemic. Furthermore, in advance, in the months of December and January, SCOVI, together with the Standing Committee on One Health, has conducted an essay competition, just as Anya mentioned before, on this exact topic. And for yesterday's discussion, we used those really great points raised by students through their essays as the baseline for the discussion. We invited a very diverse group of panelists that provided us with their insights and their expertise, and they commented on some very specific points made by students. And I would like to give you all a little bit of a summary of what was discussed yesterday. The points that were made by the students and also the conclusions made by our panel. We first discussed the general role of veterinarians in a pandemic and how students see that. And as mentioned here before today, the role of veterinarians in a pandemic is extremely diverse. And it is not possible to define one specific task. We have a very broad field that we work in, and in whatever field veterinarians work, there's always a role they can take part of and a way they can contribute. And we have discussed the influence of veterinarians in animal and public health, in the surveillance of public health in order to prevent the outbreak from occurring. But also we discussed effective ways to maintain natural barriers between animals and humans, especially in regards to the One Health concept. The role of veterinarians lies not only in the prevention, but also during the pandemics, also discussed previously here. So, for example, when we're talking about public education and the implementation of standard protocols and the safeguarding of public health. And of course, as vets, we are also involved in taking care of the aftermath. For example, all these lovely COVID puppies that practitioners are taking care now. A big point that was discussed yesterday was research, because students do think that veterinarians play a huge role when it comes to the knowledge of zoonosis, viruses, and the creation of vaccinations and drugs through research. Often, though, the part of sitting down, dealing with the data, doing research on diseases doesn't look like such a fascinating job opportunity. Students find often way more appealing to be a surgeon, a cardiologist, or a practicing wildlife vet doing, I don't know, a tooth extraction of a lion or something else exciting you can think of. We all go into vet school with a very fixed picture of a veterinarian and of the exciting dream that we have of our job and what it would look like. And due to that, we are often not open to other vets that, or the other fields of veterinary that also save lives outside of the clinic by doing research, by advocating One Health, by being involved in policymaking, or by teaching public health. It is very important that as students, we do not only seek the clinical experience and the clinical internships, but also check out local labs, food safety centers, research institutions, or public health organizations. It was also brought up by students that research should be more incorporated in the veterinary curriculum. Obviously, research-based and evidence-based education is the key standard, and all students must be aware of the importance of veterinary research and must be educated on research. However, in many universities, it is not yet compulsory that all veterinary students have to write a thesis or that they have to take part in some kind of research project. This is also due to the fact that even though research is extremely important, it is also very difficult and expensive. Modern technology, for example, in bioscience costs a lot of money. And it is also a very time-consuming addition to the curriculum. And that also brings me to the point that I would like to conclude with. We as students see the need of new additions to the curriculum. For example, the exposure to research, or incorporating disaster training programs, or exposing students to epidemiological surveillance, or giving more focused approach to the teachings of soft skills in order that we students can build a sustainable career on that. There are a lot of things that would be important to discuss in our educational settings and that we as students see, but the veterinary curriculum is very packed as it is. We all know how stressful it can be and how much we are supposed to know and to learn. And that's why it's so important to remember that we cannot simply keep adding to the curriculum without removing parts. The curriculum needs to be analyzed globally, and the day one standard and the day one competences, meaning the skills and knowledge that veterinarians should have at the first day out of vet school, those need to be discussed and analyzed. And I would like to end my summary of yesterday's discussion and the summary of the students' perspective with a call to action to our members, because especially on the analysis of our curriculum, the input of students is very much needed. And I would like to encourage all of you as students to think about the local actions that would be needed in your university to change the global aspects of One Health in the veterinary curriculum. Thank you.
Thank you, Vicky. All like the things that Vicky has summarized, I think also represent what I have in mind, and I think it's very represent all of us as a veterinary students, and I do really proud of that. All right, ladies and gentlemen, after we already listened to students' perspective, now we can continue to follow-up discussions on the topic of how future veterinarians can be better prepared to face the pandemic and the role of the university and international organizations in it. As like a previous topic, we already received questions from our members. And then the first question for this topic came from IVSA Indonesia. And I will address these questions to Dr. Stefan from EAEVE. So the question will be, what are the most common difficulties while advocating for One Health approach in veterinary curriculums? I will give the time to you, Doctor.
Thank you very much. Thank you very much, Anissa, and thank you very much also for what was said after your symposium yesterday. I share totally what were the conclusions, and this is one of our great concern to help our member establishment to develop, improve their curriculum, to rely on feedbacks from students. This is really one of the key part of the quality system we are promoting, and this is really a very important point for us. This is especially the reason why we have in any of our visitation and evaluation of establishment one expert student, because this is very key point, and this is important that you students engage yourself in the evaluation process, because it is very important to have this feedback. Our concern is, as it was said, to improve the curriculum, but without addition to the curriculum, because we all know that the curriculum as it is now is overcrowded, and the issue is not to increase the curriculum, but to rebuild and to rediscuss the curriculum to address some new day one competencies, which will mean, and everyone need to have this in mind, which will mean that we should change some of the competencies that are already taught, just to avoid that the curriculums are so big that no students will be able to follow up. So this is really where we are working on. I told you during my introduction that the education on One Health concept and how the establishment addresses present this to the student and how the students can be engaged on it is one point that will be addressed during our educational day in June, and this will drive us to promote some evolutions. I was really interested hearing about the interest of students on research being implemented inside research during their curriculum. It's something we promote, and this is one part of our standard. And it is interesting to see that students are keen to be more engaged on this. So we should also keep this in mind during the revision of our curriculum.
Thank you, Doctor. Thank you, Dr. Stefan. I will also address these questions to Dr. Despina. Please share your perspective on the questions, Doctor.
Yeah, thank you, Anissa. Again, I would say that our curriculum is at large extent in One Health curriculum. I do believe that. So the thing is about looking more critically to using the knowledge that we have achieved and transfer that to real competencies. So that is a kind of an approach that we should have in education. It's not about adding some new skills in there. It's more about understanding how to use the skills that we acquire throughout our curriculum in order to implement this One Health approach. And what we really miss in the end, in order to really promote this One Health approach, it's actually an interdisciplinary and intersectoral collaboration. This is what we have seen as a gap. What we don't understand so well and what we don't know, don't learn during our studies is how to collaborate with other professionals and how to reach out to each other for more information. And this is not only for veterinarians. This is exactly the same for all other professions. And this is something that we identified as a FEE. We saw that there is a gap in there, and we started together with other professional associations, healthcare associations like doctors, dentists, and pharmacists, to work on promoting more One Health intersectoral collaboration from university. So it's more about creating a One Health culture in university that can help us to grow up in this interdisciplinarity, and then to continue to collaborate together throughout our whole career. And this is an important aspect that we should consider within this discussion about creating a One Health culture in the end.
Thank you, Dr. Despina. I will move on to next questions. So this question is addressed to Dr. Patricia. So, Doctor, what roles does WVA play to harmonize what is being taught in the class with what is actually practiced on the field?
Thank you. Great question. And, you know, there are a number of different areas that the WVA has been working in to try to look at this matching up. And I think Dr. Martineau had also talked about projects that evaluate what the curriculum, you know, sort of is encouraging or requires right now versus how do we ensure that countries have a prepared workforce. And the WVA has an ongoing project through its Vet Education Strategic Focus Group that is looking at standards of training in countries around the world, particularly for countries that aren't currently part of some of these more recognized international accrediting systems such as EAEVE, and looking to ensure that there's a better match in the curriculum requirements, you know, and then what the workforce needs, not only in that particular country, but also to enable veterinarians to have more mobility between countries. We know that there are all sorts of barriers related to licensing and other things, but we also want to make sure that veterinary training is such that it also provides the mobility to look at opportunities in other countries. Another project that is sort of maybe postgraduate, but also speaks to this issue of you know, how do we ensure you know, veterinary education will allow participation of veterinarians in some of these big global One Health issues, is a project that actually is being spearheaded by the tripartite, so WHO, FAO, and OIE, and also has many partners in it. But this has grown out of the pandemic. There's always been field epidemiology training programs for veterinarians to investigate animal disease and for human epidemiologists to investigate human disease. But the tripartite right now is working on a One Health field epidemiology training program that will bring together veterinarians, you know, human health providers, as well as environmental biologists and engineers in this collaborative training program for field epidemiology. And it's a first and really exciting. And it's exciting to see veterinarians being recognized as part of this too, as being key partners in it. Where veterinarians take this training, because a lot of our curriculum is very focused on epidemiology. Some of the field epidemiology training may occur during regular vet training for most human health professionals. So epidemiology is a postgraduate area of study. I hope maybe I veered too much off. I'm sorry if I did, but please let me know if there's any other aspects I didn't cover there.
Thank you, Dr. Patricia. Also, I will give a similar questions to Dr. Stefan. So, Doctor, what roles does EAEVE play to harmonize what is being taught in the class with what is actually practiced on the field, Doctor?
By setting standards and by sharing those standards between a lot of establishment, not only in Europe, as I said, but also worldwide, it's a very important part to be able to spread out some of the necessity that we should maintain and we should develop to enhance the day one competencies for our graduates. So as it was just said by Patricia, it's very important to have those discussions between establishments, sharing good practice, hearing about feedback from students. Once more, I emphasize this because we really experience the very positive aspect of the students' perspective every year during our educational day. There is now a presentation by students on each topic on the point of view from students, and this is really well received by our establishments. So we don't want, we don't want to have one curriculum everywhere, because it's very important that the diversity can be expressed, and that each establishment should be able to adapt and to develop its own program. But we aim really with our standard to have a high level of quality, to share this, and also to share experience, to share new ideas, to share new tools between establishments, to be able to go over with different experience. In this aspect, during the pandemic, there was, as we all know, there was very strong actions linked to the necessity of stopping presence in the schools. But there is very interesting tools that were developed by different establishments all over the world to allow students to be exposed to different cases, even in those strong period. So this is what EAEVE trying to do during its activities to develop those aspects.
Thank you, Doctor, for the answer. I think we can move on to next questions addressed to Anya from IVSA, from our member in IVSA Austria. So Anya, the question is how can students take action within and outside of the university when it comes to pandemic prevention and One Health approach?
Thank you very much for the question. I think it is a very important one, important question to me, but more importantly, important question for each IVSA member to ask themselves. I think I cannot highlight enough the importance of building awareness among fellow IVSA members, fellow veterinary students, and enhancing discussions, conversation, concluding different projects. IVSA is a great platform for it, and you can get involved in IVSA to do this on many different levels, whether it is national level within your local MO, whether it's regional or global level. Please keep in mind that every action, every discussion matters. We are 38,000 students after all. Secondly, by being advocates, basically speaking up for ourselves, speaking up for our needs including mental health, improvement of veterinary curriculum, calling for One Health approach in veterinary education, more skills-based approach to veterinary training, soft skills, find different ways to reach out to our veterinary faculty, to other relevant stakeholders. We can definitely do that. as veterinary students. And as I experienced in my past half a year being president of IVSA, we are really listened to, something that not only Dr. Stefan, but also our guests today highlighted. Our voice is very, very important. And lastly, collaborations. Collaboration with other student associations, collaboration with international collaboration among each other, regional collaboration, multidisciplinary collaboration with other professionals, also collaboration between different generations. So working with our partners, working with professors, youth, being involved in basically being part of the solution. And you can do it by IVSA, of course. You can do it through different mentorship programs through university. So yeah, raising awareness about this collaboration, it is, I think, very important at the very early stages of education. So these are like the three main aspects I would like to highlight, and with this concludes this question. Thank you very much, Anissa.
Thank you very much as well, Anya. So I think it will be like our last questions. Always like we have like more time to discuss these very interesting topics, and unfortunately we have like this time limit. But to close our panel discussions, I will give the opportunity to our panelists to share like the conclusions and also advice that you can give to us as veterinary students. So the first opportunity, I will give it to Dr. Patricia. We would love to hear from you, Doctor.
Thank you so much. And again, thank you for the opportunity to participate in the panel today. I think the summary comments that were presented from student discussions and the essays just demonstrate how passionate veterinary students are on this issue. And as has been discussed as well in the chat, for me, it's so exciting to see this and to hear of student interest in these different topics, and engagement, from all over the world is really exciting to see. I think it's important to remember for all of us, and it maybe can feel a little bit challenging, when you're earlier in your career, but it is a journey. Everything that you learn, all of your experiences along the way will contribute to, your knowledge base. And, I know everybody's impatient to be doing all of these things right now, but everything that you're working on, the people you talk to, the policies you're writing they are all critical pieces and bring us one step forward. And it is through this partnership, community and consensus building that we will see action on these topics. So thank you so much.
Thank you very much, Dr. Patricia. I will give the second turn to Dr. Siraya. Time is yours, Doctor.
Hi. I think that of all the things that we've been talking about, a lot of it creates that necessity that we should all create our own awareness. And we're in the time that we could actually be doing this in a very free-flowing way. The ability that we could become aware with the issues that are affecting not just us, but all those around us, beyond even our profession. That's how we could also be part of the role that we need to be playing as veterinarians in any kind of role. But as we are going through that journey and creating that awareness, not just in what we're doing in school, but also being a part of the community that is obviously very vibrant and lively. What Anya has been talking about, how IVSA students, you're getting a call to start standing up, advocating for yourself, for how you could be a part of understanding yourself and the world around you. These things eventually lead up to also what we've been talking about here, and Pat also brought that out very succinctly as well, is how we could create that collaborative leadership together and moving hand in hand when we're facing such challenges. I think that it's very hard, how can I say, it's very encouraging to be able to hear and listen to all of these views coming forward. In fact, it probably is in most of our hearts and minds, but now the way that it can come out so freely because we are in a disruptive era, creating the ability that we could understand and be much more aware of who's doing what. I do think that there is a very exciting future, and I'm very excited that IVSA is leading the profession, in fact, in this regard. Thanks.
Thank you very much, Dr. Siraya. We really hope that, yeah, we're leading like as a future leader, like what Anya said. And then I can give the next opportunity to Dr. Despina.
Yes, again, thank you for all these discussions. It was really very nice exchanging in this on this particular topic, and I think it's very encouraging that students are so concerned about how to make a change in the future, and I think this is the first step and the most important. So I would say that it's important to also be confident about that and about the knowledge that we achieve. We should consider going on and reflect on how to change this mentality, and and acquire a more broad perspective, and through the One Health concept, trying to really contribute and make a change to both animal health and welfare, but also to public health. We need to keep in mind as veterinarians, veterinary students and veterinarians, that our target is not just animals. We're not just animal doctors. Our target should be humans and animals, and of course the environment that we all live in there and we interact in there. So thank you again for this opportunity to be in this discussion, and let's keep on working together towards that direction.
Thank you very much, Dr. Despina. So for the next opportunity, I will give to Dr. Anne as the one who give the perspective from FECAVA, as Dr. Wolfgang has to meet his patients. The time is yours, Dr. Anne. I'm so sorry, Dr. Anne. Please unmute yourself first so we can hear you.
Sorry. First of all, I want to thank you for the invitation to listen to us as FECAVA, as we are the ones who represent all small animal practitioners. And I only have one thing to say to you as students. Don't ever forget that we have the most important and most beautiful profession in the world. So keep that in mind, put it very, very profound in your head, and no matter where life brings you, or your experience or your work brings you in life, that's the only thing you have to remember. We as vets have the most important and most beautiful profession in the world. And if you live with that statement, you will find your way. And if you're in research or on the field, or I don't know where, yeah, that will bring you where you belong, and will keep you safe and happy. That's all I wanted to say from my heart as a clinician. Thank you, and all of you, very, very good luck in your future.
Thank you, Dr. Anne. Maybe in this point, I could cry to receive all the love from all panelists. And then the next opportunity, I will give it to Dr. Stefan.
Thank you very much. It's always enthusiastic to take part of such meeting where we can once more emphasize the great implication you students are put in your preparation for the future. So I will just give also a few words about the fact that vet education is, as it was said, is highly based on One Health. So you will have all the tools, and you should continue to develop actions to spread this. And also, as some of the panelists mentioned, to be sure that you are working as teams with other professions, because it is really where we should emphasize to try to develop the impact for future development of One Health. So I'm sure that you will all work for that, and as EVE, we will be ready to hear about you and to try to implement your feedback. Thank you very much.
Thank you very much, Dr. Stephen, and I will continue give the opportunity to Anya to give like some advice and conclusion to our discussion.
Thank you very much. So I would like to end this discussion with, first of all, call to IVSA members and IVSA students. I'll start with a quote: "Be the change you want to see in the world. Don't wait for others to find solutions to problems you find important. Be proactive, think about solutions, and basically being part of IVSA can give you this wonderful opportunity. Being part of IVSA can make you think, make you brainstorm with other friends, how you can already, as a student, but also as soon as you graduate, contribute to being part of this solution. So yeah, let your voices be heard at our General Assembly, and please use this event as opportunity to also figure out your own path and what you can do to also contribute to this. And to our panelists, I would like to thank you from the bottom of my heart for being here today with us, for sharing your thoughts with IVSA members, and also to always listening to us with such a respect and saying that our voice is the most important. It is really encouraging, and I hope we can continue this wonderful collaboration in the coming months, years with other presidents as well. Thank you very much.
Thank you very much, Anya. So yeah, we've come to the end of the panel discussions. And once again, I would love to say my appreciations and thank you to all the panelists to giving us the opportunity to sharing, to listen, and to learn together. And we are very honored to have this opportunity. And personally, I wish like we have more time to, have these very engaging discussions. But I do believe we will have like a futures collaborations and discussions in regard to more and more topics in the futures. And then I will give like a very short summarize. So what I can, conclude for our discussion is like focus on what we are doing as a veterinarian and how we can be a part of this keystone of well-being. And as in veterinary educations, we need to continue to make improvement to the veterinary education curriculum so that we can continue to be able to follow the needs for human, animals, and environments. And I'm really, really happy to receive all the love from panelists, from the IVSA members, and we would love to see you in the next opportunity. So I will, as moderator, I will end the sessions and see you guys all and all the panelists. I'm very happy and I know you are too. Thank you.
Thank you very much.
Unfortunately, we cannot see his name in the lobby, so I'm not sure if he joined the meeting.
Can you resend the link or have somebody send it again?
We'll resend it, yes.
Because he's got another one that it's perhaps for his talk. Let's check if can reach him.
He knows he's waiting for a link. So it's just
yeah, he's waiting for the link. Yeah.
Yeah.
Okay. Is he available on Skype?
He's not online on Skype.
Oh, yeah. Come on. Oh, I can call him on the phone. Let me. Hi, Julie. Have you received the link for my session? They're trying to let you in, but it seems that you're not in the lobby. Can you try your link? Can you try your link? Oh, but it's a different one. No, don't do that. Yeah, no.